Namaste. Thank you all for joining the Sewa in Action webinar today. We have been affected by this COVID pandemic across the world and recently engulfed India. Sewa UK, Sewa International, and the community, the global community, have rallied around the world to support India. We are delighted to have a panel of speakers today to give insights into our efforts that we put together globally, the Sewa UK appeal, as well as on-the-ground reports from India as well, and much wider. Today, we are honored to be hearing from Bharat ji Vadukul, Sewa UK, Nishant ji Aggarwal, CEO of Sewa International, Bharat, Professor Satish ji Modh, disaster management expert from India, and Lord Jitesh ji Gadhia, member of House of Lords. We will have an opportunity to ask many questions to our panelists today. And for those who have registered with Eventbrite, you will have a link directly, obviously, through Zoom. And on the Zoom questions function, you'll be able to submit your questions. So without further ado, I would like to introduce Bharat ji Vadukul from Sewa UK, who was born in Nairobi, moved to the UK in 1968, and settled in Birmingham, graduate in biochemistry and co-owner of a medical diagnostics company. He is in Sewa UK as the General Secretary and a trustee of Sewa International UK, and involved in the charity sector since 1994, and has held an executive position since 1999. Bharat Bhai has made endless trips to Bharat to see various projects within Bharat and other countries as well, from inception to their launch. Recently, in 2019, Bharat ji and 100 participants participated and drove 30 rickshaws from Kanyakumari all the way to Ahmedabad and raised £250,000 for Kokle Pune, which is a charity for children who are unable to hear when they were born, and this provided implants for them to hear, and also for them to have a preschool for their education. Bharat ji and the team have been working tirelessly over the past few months to procure and send aid to India and support the ongoing efforts and collaborate with various organizations. So without further ado, I would like to request Bharat ji to say a few words.
Namaste, everybody. Good morning, and thank you for joining us on a Sunday morning, which I think for many people is family time. Thank you so much for coming on board. Can I have the slides, please? So I'm going to talk, as Nilaji said, and thank you, Nilaji, for those kind words. I'm going to talk and give you a brief insight into Sewa International UK, and we commonly call ourselves Sewa UK, as to what we do, and then also to touch on what we've done in terms of the COVID relief to support those going through a terrible time in India right now. Sewa UK is part of a global movement of 32 countries, 25 of which are currently active in this appeal to try and support our brothers and sisters back in India. The other smaller units are then collaborating with the larger units across the globe. Sewa UK in 2008 to 9 did some introspection, and at the end of it, we decided to work on two avenues. First one was disaster recovery and relief, particularly rehabilitation, and that's where Sewa UK has done a lot of the work. And secondly, to support projects that support the needs of people with disabilities, particularly children with disabilities. And with that in mind, in terms of disaster recovery, since 2010, we have supported appeals for Nepal, where actually we supported two hostels. One is built in Navakot, a part of Nepal, and the other one got delayed because of the COVID. It should have been up and ready, but it's got delayed. The Kashmir floods in Uttarakhand, we just built a school for children because it was devastated. In Tamil Nadu flood relief, where we just supported some of the work that Sewa International is doing, and the Kerala flood relief, where we're building houses for those who lost their houses due to the floods that happened there. In terms of supporting the needs of children with disabilities and people with disabilities, this is, in fact, where we put a lot of our effort. And we're actually building capacity. What I mean by that is, there are wonderful projects, and people are asking us to support us to actually provide better services, better facilities. Our flagship project is actually the Gadhia school in Jawar in the state of Maharashtra. That was completed in 2014. It's a residential school that looks after 120 children. We then supported a daycare center for children with disabilities at Latur. It's called the Sanvedana project. A similar project in Hubli Gadak followed, the Arunodaya Special School. And finally, we have decided to support our next project is the Samaj Drusti Trust. And they do some fantastic work because they want to support people who have gone into adulthood to learn a skill, a vocational skill, so that they can actually earn a livelihood and have some sense of pride. So, this is where we've actually been focusing our efforts. But importantly, when we first decided to support the needs of people with disabilities, our very first project was to support the distribution of 500, what we call the Abra units. These are audiobook reader and recorders. And our claim to fame on that one is that one of the actors in the film Slumdog Millionaires used that product. And I'm very pleased to say they actually passed with flying colors. We tend to do most of our work in India because the Charity Commission requires us to have transparency and audit trail, and also, to be sure that we are spending money wisely. And through the partners we have, especially Sewa International India, we're able to get those reports. But we do work in other countries, particularly in Kenya and in Africa. And some time back, we actually sent some wheelchairs to Kenya to be handed over to people with disabilities. Next slide, please. Sewa International, very proud to say we have 4 service projects that all work under, if you like, our charity registration. The first one is Charity Through Adventure, a project run by Satish out of Bradford. And probably most people know this because of the Yorkshire Three Peaks Challenge that is run in May every year. And Satish and his team over the years have raised significant sums of money, which have been put to very good use. Please visit their website, we see some more information. We also have Youth for Sewa, a tremendous program where youth from this country can engage and be involved in projects in India. They spent 6 weeks in India, and it's a project that actually has 2 benefits. The person going actually understands and gets closer to India, and also the project itself gets valuable insights and experience and efforts from the youth that have gone there. Our newest project is Medics for Sewa, encouraging medical professionals from the UK to go to India and to serve the communities that are marginalized and also left behind in some cases. The project is based in Chitrakoot, and around Chitrakoot there are 500 villages where we actually do some of our work. And the Chitrakoot site itself has an operating theater, so anybody who needs complex surgery, they are dealt with at the Chitrakoot site. And finally, Cycle for Sewa. This is a project where annually a team of people led by Harish Budhia actually manages and runs a program, a Sunday event where families, youngsters, grandmothers, grandfathers all come along, and they're encouraged to cycle as part of getting fit, but also they raise amazing sums of money for Sewa UK to use to support the projects. Just to complete, Youth for Sewa is managed and run by Avnish Sakra out of Wellingborough, and Medics for Sewa is actually managed by a group of people headed by Naresh Sharma, a dentist himself out of Bradford. Next slide, please. So coming to this terrible, terrible tragedy that has hit India, the second wave of COVID. Nishant ji will give us a bigger insight or a better insight shortly. I'm just going to touch very briefly on some of the things that we've decided on. as Sewa International, the global organization. There are actually two aspects to this. One is the breadth of engagement, where we're going to work. So we want to bring awareness to the population and to the public at large about COVID, about vaccination, about good hygiene and all that. We're providing essentials, meaning we're providing essential packages to those people over the last year who have struggled to earn a livelihood, and as such are struggling even to meet the basic needs. The packages contain food, medicines, basic medicines, sanitation, and other things that are required. And a digital help desk to help people identify where resources are available. But the immediate need that was identified was for oxygen concentrators, and also to some extent vaccination. And this is where the global community of 35 countries are actually supporting. Next slide, please. Just to expand on this, is a team model, and I'd like Nishant to give you the details, but we've got awareness, so well-sourced information for awareness, essentials, as I've already mentioned, digital help desk to help people gain the right information, vaccination is very important, as has been shown in this country, and oxygen. And oxygen, and concentrators, it actually says 1,000, but I'm very pleased to say that the number is much larger than that, and I'm sure that we will hear about that soon. So in the UK, what have we done? So we took the first opportunity. Have the next slide, please. We took the opportunity to say we need to provide oxygen concentrators along with everybody else. So rapidly, we tried to, we sourced and secured oxygen concentrators, and we shipped those out so that our people in India, New Delhi office, can actually use that to get it to places where it's most required. And there are some pictures here, and there's also some feeds and some pictures on the Facebook and other social media handles. Next slide, please. Also, one of the things that Sewa International India is doing as part of what it's supporting the people is setting up what we call isolation centers or COVID rehab centers, where people with mild to moderate conditions can come. And I'm tremendously proud to say that the Divya Vidyalaya, the school in Java that is used as a school, and because currently there's a holiday in India for the children, that school has become now a COVID care center serving the community in and around Java. And it's a great, powerful and a moment of great pride for Sewa UK. Next slide, please. So thank you to all of you, to all our supporters, all our donors, all our well-wishers. And actually this slide was created about 3 days ago. I'm very pleased to say that effectively this morning, the total is in fact close to £390,000. Our target is £500,000. Our contribution to the need for concentrators is 325 oxygen concentrators already procured, 250 have reached, and the other 75 should reach by this time next week. For those who would like to support, the link is there. Next slide, please. There are many organizations who have risen to the challenge and are supporting this, this need of the hour. And I'm very pleased to say that Sewa UK initiated a collaboration with the organizations they can see. So we're collaborating with the British Asian Trust, with BAPS, the Art of Living, HSS in the UK, and also we have an e-global doctors where some of the medical professionals from the UK are looking to see if they can actually aid and help that place. With Godhamik, we're actually working on the ground route, on the ground, and I'm sure that we will hear more about that from Nishant. And final slide, please. So thank you all very much. Thank you for coming today, taking your time out, and I hope you enjoy the rest of the show. Namaste.
Dhanyavad, Bharat Bhai, that's given us so much insight into what Sewa UK have been doing over the years, as well as how this appeal was launched and the tremendous support across the country and the collaborations that have been taking place, and what we've actually already serviced and given to Bharat to start that sort of aid and support process. Thank you for those insights, and I'm sure we'll learn a lot more through the Q&A later. Over the past few months, we've had various dignitaries across the country as well as organizations support the Sewa UK appeal. Some of those dignitaries are MPs and various other government officials. And we'd like to show a short video from Teresa Villiers, MP, who has put her support forward for Sewa UK.
My name is Teresa Villiers. I'm Member of Parliament for Shri and I'm proud to give my support and backing to the efforts that Sewa UK are making to raise funds and help people affected by the COVID outbreak in India. All across the world, people have faced harm and suffering and illness as a result of this terrible virus. And the scenes we've seen in India over recent days have been distressing. But I know that Sewa UK will make a real difference in providing comfort and healing and help to many people in India suffering from the virus. And I hope very soon that we see the vaccinations start to deliver the end of the pandemic in India and of course across the whole of the world.
Thank you to all the supporters out there in the UK and various people and organisations that have supported this Sewa UK appeal. We are honoured to have Shri Nishant Aggarwal join us today, the CEO of Sewa International in Bharat. He's trained as electronics and communications engineer from Delhi College of Engineering. Nishant had worked for global companies in US and China for 20 plus years and his professional life in telecoms and IT projects. Though always contributing in different ways to social causes, he took a final plunge into social sector in 2015. Nishant currently serves as the CEO of Sewa International, leading its team across India in 12 states presently, primarily working towards disaster management, alleviating poverty, providing job orientation skills, empowering women, generating sustainable livelihoods, fighting climate change and enabling accessible healthcare for the underprivileged in hilly, remote and tribal areas of the country. He has overall 20 plus years of rich experience in leading, managing and working with diverse teams in China, USA, Nepal, in IT and the social sector and that domain. Presently, he is driving the Sewa International initiatives across India to combat this second wave that's hit Bharat of COVID-19 through global coordination, local partners engagement, and ensuring that Sewa International is able to save as many lives as it can through this dedicated COVID warriors. Nishant, we'd love to hear from you and what's going on the ground. Nishant.
Thanks a lot, Vijay, for the generous introduction. I'm very honored to be before this august crowd of people, composed of people who are working on the ground in terms of raising funds, making people aware of the global tragedy which is unfolding in India. The donors, the supporters who have been sending all kinds of resources to fight this pandemic, which is growing like a monster, and it's causing so much distress already. And also the distinguished guests who have spared their time on Sunday to come here. So thanks a lot, all of you. Sewa, slides, please. Yeah, thanks a lot. I think we can go to the next slide. Yeah, thank you. So Sewa International Bharat was established in 1997 as part of the Sewa International movement, which actually began in UK itself in 1993 after the Latur earthquake. So the Indian office of the sewainternational.org, which the domain that we own. So that office and that team was formed in 1997 to help the global community come together and help the projects which are needs to be executed in India. So we we hold the common vision that is there for Sewa International movement, that we want to see everybody enjoying good health, live in a world of equality, having equal opportunities for everybody, so that everybody can enjoy a quality of life, basic quality of life, and be happy. As our mission, we want to serve the communities in distress, aiding local communities, which you are doing it excellent way in UK also, as well as engaging, promoting volunteerism, not only among the youth and the people who can do it, but also among the beneficiaries. How can they be the agents of change to the society? On the right, you can see the map of the various activities we have been conducted in different states. You can see the scope and the variety and of the domains in which we have been conducting activities directly, as well as along with our partners in different areas where the need is there, mostly in the rural, tribal, and the hilly areas. Next, please. Next, please. Yeah, thank you. So this shows the reach. Sorry, the previous one. Can you go to the previous one? Yeah, please. Thank you. So this shows the reach of the work that we have done in last 24 years in different domains. I won't spend too much time on it because it will take up more of our time. But this shows again the depth and the breadth of our work. Next slide, please. Next slide. Yeah, thank you. So this is our flagship project. So I just want to show one project. We have more than 100 projects presently executing in different states. So this is our flagship project that we started after 2013, and which actually got into full swing after 2015, when we actually got the funding from Government of Goa's Uttarakhand Relief Fund. And as part of that, since then, we have grown into from just a few members, from less than 10 members. Right now, we have a people strength of 90 plus people who have been working in 160 plus villages, working with 4,400 women members who are a part of our SHGs, as well as thousands of other people who have been supporting us through our health initiatives, as you can see, Swasthya Sayogi Seva, through our non-farm initiatives, our farm-based initiatives. All these people, especially women in Uttarakhand, in the two districts of Rudraprayag and Chamoli, they have given us so much of trust, so much of hope, and so much of coming together. I mean, the community development has been immense in this region, and we have been able to gain the trust of the community to develop and work with them in the most difficult areas of the Kedarnath and Badrinath Ghatis. And those areas we have employment, help them with the vocational training, provide them health services at almost their doorstep, because this health service that we have shown of the mobile health service that goes around covers 250 villages in a month with 24 checkpoints, and almost serves around 100,000 people, in the sense that 100,000 people have access to this service. And every year we are able to service around 16,000 patients through that, who don't have to travel almost 200 to 300 kilometers for every small ailment that they face. And along with that, we have 7 Pradhan Mantri Kaushal Kendras, which are under the NSDC scheme of Government Skill Mission, training in different domains, including healthcare, IT, electronics, food processing, etc. Is our environmental initiative in which we are trying to revive Himalayan springs and trying to see how we can restore their flow, clean their water, and create awareness among the villages on why it's necessary to keep it clean and vibrant as it needs to be. Thank you. Next. Next, please. Yeah, thank you. So now we come to the COVID, which is the largest humanitarian crisis. You must be aware of all. Right now, as I sit in this meeting, already I have received a couple of bad news in my close friends or relatives just today. So you can know, and we know how bad is the situation in India. Almost everybody you call will come back with a sordid story of somebody, a loved one that they have lost untimely. This crisis is eating up and causing so much distress in very, very young families, in which the main earner is dying for no reason. Perfectly healthy people are dying, and the main reason remains either the lack of access, or the lack of treatment, or the virus itself. The variant itself acts up in different ways, and it's causing a huge amount of distress because there's a very little understanding of its ways of transmission, as well as how to combat it. The incorrect and fake information is causing people to spread rumors, which is causing panic, confusions, and fear. People don't know how to react to the bad news. They don't know whether to believe the good news. So this is causing too much of mess in the society. The daily deaths, as we have seen in the Unnao, where we have recovered 100 bodies floating in the Ganga River. We have also heard about 800 bodies buried under the sand. So we know the distress has now moved, and it's moved decisively from urban to the rural areas. The urban spread is only 33%. The rural spread is 67%. So we are looking at twice the tragedy that unfolded in urban areas in our rural areas. So that is presenting us with a challenge that nobody of us is prepared presently. And this is a great challenge that Sewa International would look forward to in the coming time. So please go next. So how are we preparing for that? So right now, if you see the ongoing interventions that we are doing, as Bharatji has also explained, so I won't go into details of those. So we are trying to provide medicines, equipments, and supplies, right? So this is the foremost thing. Last year, it was PPE kits, N95 masks. This year, it is oxygen concentrators. This year is ventilators, CBAP, BiPAP machines. All those things are coming up now. So we are trying to do that with the help of the global community, as you are already aware. Medicinal and sanitary kits to the poor people who can't afford it, so that they are made aware. I mean, the key part is not only distribution, but also to make them aware of the disease and when to take the ever available paracetamol in case of a fever, right? So we need to make them aware so that they know when the treatment should start. Essential kits in order for them to survive, because a lot of them have lost their jobs and or have been rendered workless due to the lockdown. And supporting COVID care and isolation centers, as you saw the pictures earlier. Serving the old age and shelter and observation homes. So this is something new that we have taken up to find out the marginalized communities who have not been addressed properly due to this lockdown, because these communities and these homes are largely dependent upon the donor contributions, which they get once the donor visits those places, either for volunteering or for celebrating some kind of events. At that time, they give a lot of donations, which help sustain these places. But due to lockdowns, nothing of that is happening. So these kind of places we're trying to support. Now we come to the online intervention, in which we have set up a digital help desk to provide them the people with the verified information. Okay, we will discuss more about it a little bit later. Telecalling based mental health counseling and countering the infodemic through our targeted campaigns on social media and our website. Next, please. So to give you a view where we are. So as of date, today morning, 10 a.m. call in India time. So we have distributed around 2,061 concentrators, which have been sent to hospitals and COVID care centers. We have confirmation for 6,500 plus concentrators to be procured, both in India, and majority of them to be supplied from the international associates across the globe. 250 plus ventilators are supposed to be shipped in a week's time, for which we have already made the advance payment, and we're just waiting for them to be delivered. 256 co-venters, which is basically rescue ventilators, should be arriving this month. 20,500 oximeters. So they have been again shipped from abroad, along with 10,000 PPE kits, which we have been procuring for our hospitals who need support. Thank you. Next. Yeah, along with that, as Bharatji mentioned about the essential kits, so 5,000 plus kits have been distributed. This time the kits numbers are a little bit low because our focus was on providing the medical equipment, oxygen concentrators, ventilators, etc. to the hospitals. So our whole team was focused on that. And also the distress was less compared to the last time because a lot of workers were able to go to their places. So this activity, but now has come up in a big way because the lockdown has been extended by almost a month now. So for a month, the people have been rendered jobless or have no work at hand. So this situation is now coming up pretty hard, and we have to supply essential kits, medical kits, sanitary kits to the people in order to survive and also protect themselves from the disease. So 30,000 more such kits are planned this month, which will be distributed across 10 states. Thank you. Next one. Yeah, so these are the COVID care centers on the left that you can see, and the concentrators that you can see next to the bed are the concentrators that have been shipped from different countries who have come from UK, USA, Australia, Norway, all those places they have come. And these have been serving, and due to contribution from people like you, we have saved hundreds of lives so far. So you should be proud of your contribution because they have really contributed towards saving people's lives. And through and all these COVID care centers and isolation centers we are sending across the country. To total 18 states, we right now have sent these concentrators of this 2061 which I showed up earlier. And along with that, we are also supporting them with the medicine support. So we are providing them with essential medicines that is required for mild or moderate or isolated patients. Next, please. As I told earlier, so for the marginalized communities, including old age homes, shelter homes, observation homes, orphanages, we are supplying them with the necessary kits to help support them for their monthly support package in a minor way. And we are not claiming that we are able to sponsor all their requests because we want to reach out to as many people as possible. So we are trying to provide them with toiletries, their medicine support, and any kind of any kind of a logistical support that is required at their end, and so that they are secure at this time and protected from the COVID. Thank you. Next, please. Yeah. So online initiatives, as I explained earlier, COVID Sewa is providing with a digital platform to search on a web page, as well as provide a chatbot in which 10+ volunteers are available anytime to answer any queries. This has been doing extremely well. Along with that, we have an initiative for mental health counseling and trauma counseling for the people who have lost loved ones or simply scared in this time. So this is called Ask. It's being operated right now from Bangalore, but will be expanded in different states later. And next is this e-global doctors, which is being supported by doctors globally to provide their medical services free for the people in India, the patients in India. Thank you. Next. Yeah, so how do we go about it? So there are various options that we are considering because each one is important. Short-term plan is important because we need to save lives now. If we don't do it now, then we will be too late. Medium-term plan is required in order to ensure that our service continuity is maintained. Long-term plan is required so that we are able to be prepared for the third wave or maybe the fourth wave, because vaccination is very scarce and we don't see any signs of that situation improving anytime soon. So we need to be prepared of such waves coming in the future also. So long-term plan is necessary for that. Next, please. The short-term plan, that is for 1 to 3 months, we plan to distribute these essential medical and sanitary kits. The cost for the all the three kits comes to around 1,600 rupees. So taking the exchange rate as 100, I mean, though it's 103 right now. So I have just put the estimate for sponsoring a bucket of 100 kits as pounds, 1,600 pounds. Similarly, for supporting some old age home, orphanages, etc., the cost we have put is around 40,000 rupees per center per month, and the cost to supporting such one home would be around $1,200. So we are looking for support from you for these centers. Next, please. For medium-term plan, we want to support the COVID care and isolation centers. These are for the newly established centers. So any new centers that we are establishing in the urban area, this is the cost. In the rural area and the tribal areas, this cost would be lesser. But in the urban area, when we are doing it, so for the COVID care center with medical care, that is with the oxygen support, regular visits of the doctors, as well as some kind of a medical support that is required by any of the patients. So such patients who have mild to moderate case of COVID, they would be brought in the COVID care centers, for which the capex requirement is around 15 lakh rupees. Operating expense, including fooding, medicines, consultations, everything included is around 10 lakh rupees per center, and cost around for 6 months is 75 lakhs. So the local team would be trying to support through food, a little bit of medicine from the local support. So 25% expense they can take care, but rest of it, we request your support to support these centers. And these are mainly located presently in Karnataka, Maharashtra, and Telangana. For isolation center, which is the non-medical care center for the families who are crammed up in their homes, so they don't have anybody, to protect them if somebody catches the infection. So in these cases, the patients can be brought here, and asymptomatic mainly, who are being supported here with food and basic medicines, etc. They don't require any special medical care. So such a center is coming around to be, for 6 months, cost is coming out to be 40 lakhs. And we request 75%, that is around 30,000 pounds per center. So that is the request from you to support these centers for 6 months. Yeah, next please. Now we are coming to the long-term plan, which is 2 years plan to support such initiatives till we see COVID decisively off our site. So online technology solutions, as we already mentioned, supporting the helpline, providing mental health counseling, and the telemedicine consultation, which is being done through e-global doctors, but we need to have a local platform for that, for which capex would be around 20 lakhs, and operating expenses would be 2 lakhs for one state. So that makes it around 68,000 pounds per year. I mean, obviously we'll be getting support from other IT companies also. So this will be a mix of the two. Spreading awareness for COVID and wash areas, which we see is the major contributor in stopping and combating COVID. So this is one of the key areas to dispel the myths and provide them the right information, for which we think for one state it could require around 4,000 pounds, and for 2 years it could for 2 years it would be around 4,000 pounds that would be required. Next, please. Yes, lot of families have lost their bread earners. Lot of families have lost, kids have lost both their parents. So such children, such youth, such elders who don't have anybody now to call their sons, their daughters. So for those families, we are looking for scholarships and scholarship for students, both college students and the school students, providing them the vocational training so that they can start earning as soon as possible, as well as providing them the regular one-to-one hand holdings, mental, psychological support, along with career counseling, so that they know what career to choose right now because they don't have the support network. For such a program, we envisage that for one-to-one counseling, we would require one resource full-time for the per state. So that would cost around, for 2 years, around 8,000 pounds. For a college high students, we want to provide them with 2 lakh rupees grant till their education is completed. That would come out to be, for 5 students, it would come out to be around 10,000 pounds. And for school students, for 10 such students whom we will be providing 50,000 rupees worth of help, it would be around 5,000 pounds. And the livelihood support through skill training, through short-term trainings, it would be around 10,000 rupees per youth for 30 youth. That comes around to be around 3,000 pounds. Next, please. Now we are talking about the medical infrastructure aspect. As we mentioned that our hospitals are lacking the medical infrastructure in a big way. And this is going to be one of the key things over the long term if we want to survive the next waves. So we want to ensure that we survey the hospitals, we understand their needs, and evaluate based upon the population density of that region, the COVID spread of that region, and the vulnerability of that region, which hospitals need what kind of support and how they can be held. So for that, we would be requiring ventilators, ICU beds, oxygen concentrators, all those kind of basic equipment that are required, along with the basic supplies. I mean, we are talking about PPE kits, we are talking about sanitizers, and N95 masks, all that need to be supplied. So for that, we have put a basic budget of rupees 30 lakhs per hospital. So that would come out to be around 30,000 pounds. We expect them to be able to maintain these equipments and operations properly and take care of those costs themselves. Oxygen generator plants is another equipment that can reduce the cost that the hospital has to incur on a monthly basis, also become independent of the supply constraints that we are seeing currently. So it's very important for us to ensure that the oxygen supplies is maintained at the hospital, especially having ICU beds and the oxygen beds. So for such hospitals, we are planning to do a capex of around 40 lakh rupees per plant. Actually, the costing goes much beyond that. So that we expect the hospital, that is around 10% of the cost, you can say. So it would be around 44 lakhs per plant. I mean, that would be expected from the hospital to be paid. And the request for one plant from our donors is around 40,000 pounds. Next, please. So thanks a lot for sparing your time and hearing me out. I really appreciate and the contributions that this crowd has made towards saving our brethren in India. And we are really grateful for that. Thanks a lot.
Dhanyavad Nishant, that was really insightful to see what's going on the ground and ensuring all our donors feel that the action is taking place on the ground, and also the long-term planning, the vision that's there. It's not just about tackling the issues that we have now. The issues now create problems and issues for long-term as well. And I think that foresight and vision with Sewa International truly helps us understand the bigger picture. If anyone's got any questions, please do pop them into the questions function on the Zoom call that you're on. So please do submit those, so you'll have a chance to ask questions to Bharat, Nishant, Satish and Lord Gadhia. Without further ado, what I'd like to do is introduce a special guest speaker who last night just confirmed for us, and we're honored to have Professor Satish Modh. Satish Ji is currently a professor and director at VS Institute of Management, Mumbai, affiliated to the University of Mumbai. He is an author and researcher in the field of ethical management, airlines management, and disaster management. He has written a pioneering book titled Ethical Management based on Indian Value System. He is also the author of a popular book, Discover the Origin in You, published by J.Co. Publishers. In 2001, Professor Modh visited Gujarat after the earthquake and lived with volunteers and various NGOs. This created an interest in the field of disaster management. And he has started giving lectures on how to save lives, our own lives, and help others during a disaster period. He went to publish further books. He's published many books on disaster management, namely The Citizen's Guide to Disaster Management, Introduction to Disaster Management, Managing Natural Disasters, and Managing Technological and Environmental Disasters. We are truly honored to have Professor Satish Modh attend today to give us a very high-level insight. I think we'll have to have a session with Satish Ji on his own for this, but he's given what the impact has been on India itself. Satish Ji, thank you. Over to you.
Thank you for this nice introduction. Bharat is facing a worst kind of disaster. All of your concern shows that whole world has understood the impact of the kind of disaster India is facing. In last 1 week average, if we take the number of daily COVID patients, it will average to 3.5 lakhs. And if you look at the number of days a COVID patient has to spend in the hospital or a COVID center, it will be more than 35 lakhs. So for any medical system to take care of such a large number of patients is very, very challenging. And Bharat is facing this big challenge, not only with the resources within the country, but lot of help from well-wishers from across the globe. But how this crisis has assumed such a big proportion? If we go into the start of this pandemic last year, India did very well. to face this disaster. On 22nd March, we started a lockdown in the whole country, which lasted till May. And from June onwards, unlockdown procedures started. That was the period when the whole world was facing huge mortality because of the first phase of COVID disaster. We had seen videos of death happening in New York, in Italy, and it was a very heartbreaking scenario. But at that time, the government in India and all citizens acted collectively and followed most of the procedures needed to prevent the spread of this pandemic. And by September, October, everything started looking very, very normal. And in fact, November, December, January, February, people started behaving like everything is normal and this phase is gone. And this actually created a big playground for the second attack of coronavirus. And from mid-March, the number of patients again started rising. But the success of the first phase of handling coronavirus pandemic had made all the governments and citizens very, very complacent. This is one of the very, very major factor, which is the cause of this wide spread of pandemic in major cities and also in villages. Of course, we can also say that the second attack of pandemic has happened because of a new corona variant, which is spreading very, very fast. In fact, I myself became one of the first victim of corona in March, on 18th March, when I had gone to Bangalore and returned. And within 3 days, myself and my wife both had this corona virus. And we were under strict observation by municipal corporation. And there were daily calls from BMC doctors and officials to look into our health. And they were monitoring our oxygen levels and all the symptoms regularly and very, very thoroughly. And I am sure the same thing was happening. Systems were in place, but the number is so huge that no system can actually take care of that. The second problem, why the pandemic took such a large scale, is that doctors were tired of this 1 year of continuous monitoring of so many people, and the infrastructure which was upscaled in last 1 year, almost more than 10 times by the government, state government, central government. But those employees who were there and the infrastructure in the old hospitals were in such a bad shape that you might have heard many stories, like in Maharashtra, where the oxygen was not given to patients because the supply was broken, supply line was broken. In one of the cases, while going home, the paramedics closed the oxygen valve and went away. Like that, we hear many, many stories of neglect and infrastructure collapse, which generally happens when the pandemic is at such a large scale. But definitely with the support of international community and Sewa International, UK, USA, and all such organizations, India is coping with this, and the daily rate, positive rate, is now coming down, and it is now 3,20,000 as on today. But the rate of mortality is still 4,000, nearly 4,000 per day. So these are the cases which were there for last 15-20 days. And because of ventilator and oxygen shortage, many of them were suffering. The second point which I would like to bring to your attention is prevention of pandemic, this coronavirus. And nowadays we hear a lot about vaccination program and the failure of the government of not having proper vaccination program for the country. If you really look at this whole vaccination thing, on 16th January, the government of India started this vaccination program. And as on today, when I looked at the figure today, 18 crore 22 lakh people have been vaccinated in India. Now that if you look at the total population of Germany UK, France, Italy, it will exceed the total population. The whole population would have been vaccinated. But India is a very, very large country with nearly various approximate figures, 130 crore to 138 crore. So this does not even come to 10% of the population. So the government has come out with policy that people with 45 years and above, and people who are in situations where they are actually working in hospitals, and those who are subjected to this virus, they should be vaccinated first. But there has been a kind of campaign in the country right from when the vaccination is started, that this vaccination is going to have a bad effect on the health of people. And nearly for 1 month or 2 months, there was a very, very bad press, and the examples were given from blood clotting in USA or some death in UK or somewhere. And a kind of campaign was there on TV. Almost every day you open the TV channel and you see that this vaccination is going to harm you more than actually. So this is the kind of media, irresponsible media we had. And they created a fear in the mind of people to go for vaccination. But of course, in last 2 months, once the pandemic, the second wave has hit so cruelly, so a lot of people are now suddenly queuing up for vaccination, and there is a big hue and cry about vaccination. If you look at the vaccination plan, if you want to vaccinate more than 60% population of the country, we need 5 million doses per day to vaccinate 60 to 70% of the population to make this virus ineffective. And if you want to vaccinate the whole population by September, then we need 10 million doses per day. Now, India has allowed not only Covishield and Covaxin, which was developed in India by Bharat Biotech, but also Sputnik 5 has also been allowed. And in Andhra Pradesh, the manufacturing is started. And by next week, millions of doses of Sputnik will also be allowed. Government has also allowed state governments to go for their own agreements with various manufacturers of this vaccine so that they can act on their own and import these medicines from their own budget. So a lot of efforts are being made. The whole vaccination process is being decentralized so that majority of Indians will be vaccinated by September. We expect that this worst phase of second wave should be over by the end of June. The incidence of pandemic should come down to less than 1 lakh, which of course is still a very large number, but it may come down even further. Even then, we have to be ready for the third wave or the fourth wave, whether it will come or it will not come, because when the whole world is vaccinated, the chances of spreading the virus will be less. And when majority of the population is vaccinated, the incident of corona patient going from mild to severe will be very, very less. And the stress on medical system will be less. We hope that we learn lessons from this second wave of this pandemic, and citizens continue to follow precautions. Just yesterday, I was in an event where one initiative was launched in Palghar district in Mumbai. It is called Akshay Sahyog. Nearly more than 100 industrialists and financial consultant and others joined hands to form this NGO, and they contributed more than 1 crore each. For what? For finding out those families where the bread earner has died, and they are really suffering. Just some kind of food grain being supplied to them or counseling will not help. They will need money to actually go through with their life. So this is a very, very large initiative, and this initiative is launched in Palghar district in Mumbai. And I am sure similar such attempts will be made across the country by our various volunteers. Now we are in the process of collecting information across the Mumbai and Palghar district. That we are identifying such families where the breadwinner is lost, and we may have to support the family for a year or two for their education and their basic needs so that they don't get destroyed, the families don't get destroyed. The pandemic is very severe, and we all have to come together and make our best effort to see that the humanity does not suffer because of this pandemic. Thank you.
Dhanyavad, Professor Modh. That was really insightful to know and really understand the sort of impact that and the challenge that Bharat faces with the immense population and the actual planning that would be required to try and overcome this, which is going to take months, if not years. I'd like to just quickly show a short summary video, just a minute, to bring us back to the sort of UK appeal, and then we'll be being addressed by our final special guest speaker. We are truly honoured to have Lord Jitesh Gadhia address us today. Lord Jitesh Gadhia, an investment banker and a businessman, and who is a member of the House of Lords since September 2016. He is on the board of the UK Government Investments and Centres of Excellence for Corporate Finance and Corporate Governance for the UK Government. He was a senior managing director at Blackstone and has over 25 years of financial services experience. Lord Gadhia is appointed as a member of the UK India CEO Forum by the Prime Minister and serves as a trustee with the British Asian Trust, a foundation established by His Royal Highness the Prince of Wales to connect the diaspora communities with philanthropy causes across South Asia. Lord Gadhia has served as a trustee at Guy's and St Thomas Charities and of Nesta, and is an alumnus of the Forum of Young Global Leaders selected by the World Economic Forum. Jitesh ji has been truly instrumental in supporting various organizations in the UK, including the government, with advice, guidance, and connections to quality suppliers, logistics, and managing the UK's response. Without further ado, we are honoured to have Lord Jitesh Gadhia address us.
Thank you, Nilesh. Namaste and warmest greetings to everyone. It's an honor to join today's webinar as the whole world responds to the COVID emergency in India. Since the beginning of the pandemic, I have been quoting one particular phrase quite frequently, namely, a crisis doesn't create character. The way in which the global diaspora has responded, both at home and abroad, demonstrates our values in action, especially through Sewa or selfless service. The work of Sewa UK embodies this important virtue in all its forms, as we have been hearing from the excellent and informative presentations by Bharat, Vadukul and Nishant, Aggarwal, and also the comments from Professor Satish Modh. They have described the speed and agility with which essential medical supplies have reached the front line, and how contributions from the UK and across the world are already making a positive impact on lives and livelihoods. I would like to offer my thanks and sincere appreciation to everyone across the Sewa network, the organizers, volunteers, donors, and partners for their incredible efforts to help India during its hour of need. A few years ago, I was the first British parliamentarian to quote Swami Vivekananda during a debate in the House of Lords. And today, it feels appropriate to invoke his wisdom and noble thoughts again when he says, "Service to mankind is service to God." At times, it has been difficult to watch some of the scenes of suffering which we have seen in the media, and we feel almost overwhelmed by the scale of the challenge in a subcontinent as vast and populous as India. We might even wonder if our support provides more than a drop in the ocean. Yet we all feel a duty, even a compulsion, to step up at this moment of humanitarian need. And whilst no single group or organization alone will solve every issue, it is evident that we are collectively making a positive difference on the ground. It is heartwarming to see how the diaspora community in the UK has united behind this common cause. It represents a powerful manifestation of the living bridge first identified by Prime Minister Modi. Although there are multiple fundraising campaigns by different organizations, there is also some wonderful collaboration behind the scenes, helping each other with sourcing, logistics, and contacts. Bharat alluded to some of this activity in his presentation earlier, as did Nilesh in his introduction. Wherever possible, I have been pleased to encourage and facilitate this cross-community cohesion, which enables every pound, dollar, or rupee from the public to be stretched and used for maximum benefit to reach those most in need. What is also impressive is the wider solidarity shown towards India, coming from well beyond the diaspora community. I would like to highlight two other notable sources of support from around the world. The first is the response of virtually every country and government, including our own in the United Kingdom. Just over 3 weeks ago, on Saturday, 24th April, I received an urgent call from the Foreign Office informing me that the government of India had requested international help, particularly to address the shortage of oxygen. A small UK-India task force was formed, and we immediately went into action that weekend. I was able to speak personally to the head of the British Oxygen Company, or BOC, and reached out to a range of other organizations in my network. As a result of those efforts, 5,000 large 46-litre cylinders and 3 oxygen generation plants. In addition, the NHS was able to draw into its contingency stock, supplying over 1,200 ventilators and almost 500 concentrators. With the help of various airlines and our respective air forces, it was possible to arrange for these supplies to reach India on a timely basis. What I am describing are the efforts of just one government, but these are replicated across the world as virtually every nation has been galvanized into action. It is worth reflecting on why India is able to command such incredible support. Among the factors is undoubtedly the cordial diplomatic relationships which Prime Minister Modi has carefully cultivated over many years, amplified in more recent times by Dr. Jaishankar. Secondly, the selfless way in which India has implemented the Vaccine Maitri, or Vaccine Friendship program, supplying over 66 million doses to 95 countries, demonstrates to the international community that India has not been hoarding vaccines for itself. Indeed, when India speaks of Vasudhaiva Kutumbakam, the world is one family, it is practicing what it preaches. The other notable source of support has come from international corporates, which have devoted millions to helping India. We have a live example with Sewa International receiving a donation of $2.5 million from Twitter, and Sewa UK benefiting from employee fundraising initiatives and match contributions from major companies like Barclays and PwC. If we examine the underlying factors which have amplified this corporate concern, it is clear that many multinationals either have sizable operations in India or increasingly significant numbers of employees of Indian origin. So in an indirect way, the diaspora has played a pivotal role in securing corporate support, as well as making their own direct contributions. In summary, we have seen the global Indian community governments and corporates coalesce in a unique way to meet the needs of the hour. And it is wonderful to see an organization like Sewa UK and its affiliated network playing a full role at the center of this triangle. Finally, I would like to end with some brief comments about where next. Over the last few days, we have come to better appreciate the increased transmissibility of the so-called India variant, and now understand what is driving the COVID tsunami which has hit India. From our own UK experience of the Kent variant last December and January, we know the race is now on between the virus and vaccines. In India, only around 4% of the adult population has received both doses of the vaccine, with almost 15% receiving one dose. This compares to almost 70% of the UK's population receiving one dose, and over 37% with two doses. But we know the explanation is the absolute number of doses which India requires, as Professor Modh described. So I believe the next stage of international cooperation should address not just oxygen, but the vaccination program in India and other similar large countries. This is a topic which requires multilateral coordination, and I hope the UK, as chair of the G7, will make progress at the forthcoming summit just a few weeks away in June. In the meantime, the challenges faced by India are a powerful reminder that we are part of something far greater than ourselves. And I strongly believe that how we help each other now will help shape the type of world we emerge into after the crisis. Thank you for inviting me to contribute to today's timely and informative webinar. Namaste and warmest greetings to everyone.
Thank you, Lord Gadhia. That was truly insightful and gave us a linkage back to our dharma and our values, and how actually India carried out its dharma, which helped the world, and now the world is reciprocating duly. So without further ado, I would like to sort of open up the Q&A session. And if you've got any questions, please put them into the panel. We aim to finish within about 10 minutes or so. So we have some time for some questions, and I'd like to welcome our panelists, Bharat ji, Nishant ji, Satish ji, and Jitesh ji on the panel. And we've got a plethora of questions come in, and we'll just start ensuring that we can get through some of these, and if we can't get through all, we will respond to those in other ways. We have all the panelists on. Okay, so let me straight away start with the first question. We've seen, this is from Ilaben Ilaben Patel from UK. We've seen many news and media clips showing that donations sent from abroad are not getting deployed by NGOs in a timely manner. Can you shed some light on how Sewa UK is managing this challenge and making sure that the equipment and donations are reaching the actual people in need? I'll put that to Nishantji.
Yeah, thanks a lot, Nileshji. A very relevant question. Thanks, Ilaben, for that. I think this is a concern that is being raised by many of our organizations who are working on the ground, because what has been happening is after the FCRA amendments that were effected on 29th of September 2020, we are not allowed to subgrant any of the foreign donations that are being received. Also, all the NGOs were supposed to open up a new account in SBI Bank in New Delhi branch. So a lot of organizations, due to various reasons, lack of capacity, and due to the administrative hassles and lack of capacity at the bank, have faced challenges in this respect. So how Sewa UK is working with Sewa Bharat is that whatever money, donations, equipment is coming, everything remains in the name of Sewa International Bharat. So all these concentrators, ventilators, oxygen plants that we're talking about, All these equipments will remain in the name of Sewa International Bharat, will be run as a Sewa International project, which will be closely monitoring and working as partners with the NGOs on the ground. So not all the NGOs have this capability to manage multiple partners across states, which is the capacity we have developed over our last 24 years, and along with our presence in almost 20 states. So this is how we are able to manage and able to get those donations, concentrators in different areas. And we have a well-established process through which we'll be tracking those along with our partners on the ground. Hope this answers the question.
Thank you, Nishantji. We've got another question here from Harish in UK. This is for Lord Gadhia. The UK media seem to be portraying a negative side to India, even though India has vaccinated more people than the whole population, as mentioned in your address. How can the UK government ensure that more balanced reporting happens?
Thank you, Nilesh and Harish, for his question. I think what he highlights is, frankly, an issue which has been of long-standing concern to many people. And in the interest of time, my answer is, I think, very sort of direct, which is that the government has a framework, a regulatory framework, which requires balanced reporting. It is then, I think, for individuals and the public to ensure that that framework is properly used. And I think everyone needs to get a lot smarter at ensuring that when they see reporting which is unbalanced, that they either go to Ofcom for TV and the BBC directly, if it relates to coverage by BBC, and to the Independent Press Standards Organization, if it is to do with print media. And there are some very relatively now easy ways to directly submit those complaints. And I would encourage people to make sure that they do that where they see unbalanced reporting.
Thank you. Thank you again. That's truly important in how we sort of tackle this media challenge that we've always had. Another question that's come in, and this is for Bharatji. You mentioned earlier that there's been £400,000, nearly £400,000 raised, probably hit that today. What percentage of donations go to the appeal or other appeals that Sewa UK have made?
Thank you, Nilesh, and thank you for the question. For all appeals, and this has been true since Sewa International has been in existence, 100% of donations go to the appeal. So the question remains, how do you manage your costs? So firstly, Sewa International is run fully by volunteers. We don't have a single paid employee in the UK, not one. In fact, everybody is a volunteer who in the daytime earn a livelihood to manage their homes, and in the evening, and any spare time they have, they offer the services to Sewa UK. Secondly, we do have some administration costs, as you would imagine, phones, fax, insurances, and such. And we are very fortunate that we have two charity shops, one in London, one in Birmingham, which are again managed by our elderly volunteers, everybody over the age of 65 who come give up the time, even in these terrible COVID times. And the income that we generate in those two shops covers our expenses, which are very minimal. And you can see all of this information on the Charity Commission website. Just go to Sewa UK, you see what our expenses are. Thank you.
Thank you. And we've got one question for Satish. Satish, in your experience of disaster management, how would you sort of either rate or understand how the government has managed this disaster under the challenging circumstances that we've had?
Since, as I mentioned in my first part, the government was very, very active, and it unfurled a plan of total lockdown, economic package, and at that time, the treatment protocol was not available, and the coronavirus was very, very new. So that was a very, very good step by the government, because what we see today, in spite of such a huge infrastructure being created over a period of 1 year, If these numbers were there last year, we would have seen at least 10 times more deaths per day and 10 times more patients per day. So the government had a very good foresight, and though it faced a lot of criticism about the economic slowdown, but they took very, very harsh decision. And by the time the second wave has come, the government is ready with a lot of infrastructure, and there is a WHO protocol for treatment of this medicine, and most of the medical fraternity knows how to deal with this coronavirus. So the government has been very, very proactive, and they have actually implemented a very good plan to see that there were very less mortality in the first wave of the coronavirus. The second coronavirus hit suddenly, and the number of patients started increasing in an exponential way. And people were unable to actually see that how this is going to go. And by that time, the central government had decentralized the whole management of COVID. And many of the state governments were not very quick to take preventive steps. And that is the reason what we see today is the large number of patients. But then again, there is a good coordination between state government and central government. And we will see that this will result, and the results will show very shortly. Dhanyavad.
Thank you, Satish ji. We do have many more, but I am wary of the time, and it's a Sunday afternoon. And just like to thank, obviously, Nishant ji and the team, and others need to continue the work on the ground as well. So I'd like to, say thank you to all our panelists today for attending, and also making sure that they very informative answers to these questions. If there's any other questions, we will try and answer those through direct channels. This leaves us just coming to a close, and I'd like to invite Hema ji to, Hema ji Mistry is a graduate in animation and works as a creative designer. Hema ji is on the Sewa UK Appeal social media team, creating all these assets of wonderful information and material to keep us abreast of what's going on and keep us engaged all the time. Hema ji.
Thank you, Nilesh. Namaste, everyone. Firstly, Sewa UK would like to thank all our donors, without whom Appeal would not have reached approximately 400,000 in such a short time. Our heartfelt gratitude to so many organisations and temples across the country supporting Sewa UK Appeal through promotion, holding events like Bhajans, and also donating generously to the Appeal. Thank you to our speakers today, Bharat ji from Sewa UK, Nishant ji from Sewa International India, Professor Satish ji Modh, and Lord Jitesh ji Gadhia, who also gave detailed insights into our appeal from both UK, global, and what is happening on the ground, and an informative Q&A session with a great supportive message from Lord Gadhia. Thank you. We are also humbled to have support from various organisations like BAPS, Art of Living, BAT, and Go Domric, where we connected to collaborate in making a real difference together on the ground. Also, Maynard Wright for managing our cargo, Hoshad by Palmer and Entech, our suppliers. Last but not least, the entire Sewa UK team and various volunteers working tirelessly to initiate, promote and manage this appeal, enabling UK Indian diaspora to give their support and contribute. And finally, thank you all for joining today. Namaste. Back to you, Nilesh.
I would like to just echo the heartfelt thank you and the dhanyavad to all, especially to the frontline volunteers and who are working tirelessly to deliver our contributions to the people in need. Many of them, I was speaking to Nishant earlier, many of them haven't been vaccinated yet, and they're putting their lives at risk to give our contribution and our donations that those people really need. So our heartfelt gratitude and dhanyavad to those frontline volunteers. May we all pray for the victims who have unfortunately departed from this virus and the impact indirectly from this virus as well. And more importantly, let's pray for the people that are recovering and pray for the collective strength, global strength, for this global community, which emphasizes one of our key values of Vasudhaiva Kutumbakam, the whole world is one family. I would just like to end with a video and thereafter the webinar will close, which just summarizes the Sewa UK and International's journey, and which has really truly come together to support India in this challenging time. Thank you all for joining today. Our sincere gratitude to the panelists and informative discussions, and we look forward to your continued support for Sewa International. Namaste.